Everyone. My name is Stephen Simpson here with Chicago Normal, and I'm excited to be bringing to you today our men's health segment for our 420 virtual summit. And today we have two subject matter experts that we will be discussing some very exciting and important issues with. The first of which is Sarah Suzuki. Sarah is the founder of Chicago Compass Counseling, a group practice dedicated to serving the family system through inclusive, evidence-based behavior change counseling. She offers a self-paced online training for therapists on psychotherapy and cannabis. As a speaker, Sarah enjoys presenting ideas that ignite and inspire. She grounds her approach to both counseling in an anti-racist analysis, sharing a vision of a multiracial and multicultural transformed society. In 2018, her talk on facing fear went viral, with over 2 million views and counting. Sarah has been a member of the Motivational Interviewing Network of Trainers since 2010 and participated in the certification process in 2017. To date, she has worked with more than 50 organizations across the country as a trainer and consultant. And our second subject matter expert is Dr. Frank Lucido. Frank Lucido is nationally known as a medical cannabis clinical specialist of high standards. He has been performing medical cannabis evaluations since 1996, when California's Proposition 215 passed. Dr. Lucido was one of the first physicians to recommend cannabis for patients under the age of 18. He has also provided primary care in Berkeley, California since 1979. He's originally from Detroit, Michigan. So our first question is for Dr. Lucido. And we want to know, what are the basic health benefits cannabis provides specifically for men?
Well, that's a good question. I've been thinking about how it can be specific for men, because a lot of the things that it's good for, when I've done surveys, it's things that would not necessarily be gendered, but I do have a few things. First of all, the surveys that I've done on the 1,000 patients that I saw the first couple of years each year were chronic pain, seemed to be 60 to 70% of what patients were using it for. Mood disorders were next, with anxiety, depression, insomnia, PTSD. Gastrointestinal disorders, which it could include a number of things like abdominal cramps, constipation, anorexia, headaches, and of course that's of several kinds, migraines, tension headaches. And then there's, some of the things that are less common, like cancer, but still are a big issue. We know that I wouldn't call cannabis a cancer cure, but we know that it can decrease the growth rate of some types of cancers and can protect in that sense. So prostate cancer and other cancers might be specific to men in some cases. Again, specific for men, but not really, would be exercise. Men are, more into sports, although that really is changing now in the last 20 or 30 years. So we see a lot more sports injuries in women too. But again, sports injuries after sports, sometimes before sports, if it's something like skiing. I know I've had people tell me that they go out, they beat themselves up on the first run or two, and then they take a break, they smoke one, and then they go back down, and they're just much have an easier time skiing down that slope afterwards. Looking at specific things like sex, which I think everybody's interested in that. Just about, it can help people relax. Dose is very important. Obviously, just like with alcohol, too much can make people function on a lesser scale than they might, but a little bit might relax people that are tense and nervous. So those are just some of the areas that can be specific for men: exercise and sex. It's not like Viagra. It's not going to increase your erection. It's not going to increase your libido, but it can decrease some of the stress that sometimes can decrease your performance and function.
Sarah, do you want to jump in a little bit and add anything specifically to the part about sexual health for men?
Yeah, well, so while I am not, a medical doctor or biologist or scientist, I do agree that there is that, similar to alcohol, an optimal window of functioning. We know that, for example, when people drink, if their blood alcohol concentration is between 0.04 and 0.06, that's generally the optimal window for most people to feel more relaxed, to enjoy sex more, to actually be better at it because they're less preoccupied. But most people think of zero point zero 0.08 with drinking because that's the legal limit for driving. Similarly, there is that optimal window for cannabis for each person, and it requires even more discernment and individual medical expertise to help people understand what that window is going to be for them, because there are so many individual, environmental, cultural factors to that. But I would agree that there's that sort of optimal window to get the desired effect, but then you can sort of blow past that pretty easily. And then things like sexual dysfunction, I would imagine, would increase once you're past that optimal window.
Yeah, and this is probably a good time to talk about CBD versus THC, because we're in a society where more is better sometimes is promulgated, and that's not necessarily so, especially with, as we know, with alcohol, and certainly with cannabis too. There's no lethal dose for cannabis, so massive doses have never killed anybody, but it can make people drowsy. It can make people, less coordinated. So that's the THC effect. Whereas CBD, you can have, whereas THC, let's go back to THC. THC, I like to use the comparison to Marinol, the synthetic THC. That comes dosed in 2.5 milligrams, 5 milligrams, and 10 milligram tablets. So you figure somebody that's not used to it, 10 milligrams is a big dose of THC. But for CBD, that might be a starting dose. People have taken 1,000 milligrams of CBD and it doesn't cause drowsiness. But people don't usually need that much CBD. It would still be, instead of 5 milligrams of THC to have pain relief, you might use 30 milligrams or 20 milligrams of CBD, and you wouldn't have the intoxication. So again, if you're using it for relaxation, for muscle pain, then CBD might be the way to go if you don't want the altered consciousness. And again, for sex, a little bit of THC can be very nice. But I personally have been a cannabis user for 50 years, so I don't mind talking about it. But I prefer something that's 50-50 THC and CBD. I feel better without being as intoxicated. I can still feel the good feeling in the body, which is what you can feel with the CBD. It's more of a body sensation, and but still have more of the alertness that you might want, for other parts of your life, whether it's being with your partner sexually, or whether it's driving or sports. So I'm a big fan of CBD. I'm not a big fan of CBD from hemp, but CBD from regular cannabis, I think it is preferable. Like I said, personally, I like something that's 50-50 THC and CBD, because I can be more clear-headed and still enjoy the feeling of the pain relief and the relaxation that you get from cannabis.
That would certainly be some of the guidance we'd offer, particularly for men who have, let's say, anxiety about sexual encounters, especially for individuals who have specific anxiety disorders, like generalized anxiety disorder, panic disorder, obsessive compulsive disorder. We tend to guide them more towards ratioed doses of CBD to THC rather than pure THC, because it can actually put somebody into a more anxious state if they already have that predisposition. And I'm really being clear here that I'm talking about specific anxiety disorders or people who have high levels of anxiety. We're not seeing quite the same thing with people who have post-traumatic stress disorder, which is actually a really different process in the brain. But for people who know they have anxiety disorders and they have anxiety about sex, for men in particular, they would certainly want to talk with a practitioner about what a good ratio would be for them so that they can go into sexual encounters feeling confident rather than overwhelmed and terrified.
That's right. Yeah, and it's so varied from one patient to the next. I know friends of mine, women and men, who their medicine is the THC. They can function on that. And then, but if that's what, in a society where sometimes more is promulgated as better, sometimes there's that doing what the kids do, even as adults. Oh, if that's good for you, I can do that too. And you have to find out for yourself what it is. So when I see cannabis naive patients, and I'm really used to this now because I've seen over 300 kids. I mean children with autism and or seizure disorder, many of them with both. So I've had to get used to dosing with CBD ratios that are 8-to-1 CBD or 18-to-1 CBD to THC. And this translates well to adults too that are cannabis naive. So you really want to start with what's the THC level or the CBD level that's going to make them feel their symptoms better, controlled, and then maybe add back a little THC if they need that. So again, for the kids, it's you want to control the seizures with the CBD, and then you want to add a little THC for the behavioral issues of the autism. Well, for adults, it can be the same thing. You want to, see how much the CBD is going to help the physical body sensations, maybe the relaxation, and then add a little bit more THC if they need it for the, mood elevation. But those are like two different dosing strategies.
Gotcha. That's really, really helpful. And I just want to dig a little bit more into, I guess, the stigma that marijuana decreases sexual function. And if you all can go into where that stigma comes from. And I know that you've spoken a little bit about this, Dr. Lucido, in terms of dosage and the method of consumption. But could you, I guess, just elaborate a little bit more on how the strain, dosage, and method of consumption might inform sexual health for men?
Yes. Certainly, I want to touch on one thing you said where people have talked about. So part of the my training early on 20 years ago was when I realized that now not only have I used it for 30 years by that time, it's been 50 years now, but now I've got to talk to other people about their use. So I read one of these books called Marijuana Myths, Marijuana Facts. And, the drug war people will tell you that it virilizes women and feminizes men. So it's a lot of BS. Almost all of it. There's a few things that you need to watch out for, but it doesn't cause cancer. It doesn't cause mental illness. So there's so much misinformation out there. So like with anything, too much of something can affect you badly. So too much THC can make you less interested in sex or less interested in a number of other things. But finding your dose is really important. And as adolescents tend to follow, their peers, it's important that the education gets out there and not just from the DARE program like we had 20 years ago. Dosing is really important. So it's important to know that THC, 2.5 milligrams is probably a reasonable starting point. But CBD, you can have quite a bit more and without the intoxication. So that's my, my advice is to not overdo the THC and add the THC back a little bit at a time to see what's your optimal dose.
And as a substance abuse counselor, over the years, I've worked with a lot of people in recovery from a lot of things, and in particular men, which is pretty much exclusively the population I work with. And, where do I see permanent impairments when it comes to sexual function or even interest or libido? Cocaine, absolutely. If somebody is using cocaine and they get into cocaine dependence, they can find that it's almost impossible to have sex once they're in recovery. Methamphetamine, alcohol, we know is something that very quickly can shut down somebody's ability to not only perform, but even to feel pleasure of sex if they overdrink. And more importantly, would be cigarette use, that creates a lot of impairments in blood flow, which is certainly necessary for peak sexual performance. So when we start to like contextualize the relative scale of how much risk there is to someone being able to be present and enjoying sex, or even long-term risk and damage, cannabis simply doesn't even like get on the radar of high risk relative to those other substances. So, yes, there's absolute, it's not to say that cannabis is totally safe and will have no effect on sexual performance, but we certainly were sold a lie, not only with, dare, but even cultural and implicit messages in our society about how cannabis makes you unable to enjoy things or do things, when really for a lot of people, it's quite the opposite. They're able to be more present, to let go of worries about the far future, they're either control or regrets about the past, and to actually take pleasure and be present in their lives, again knowing that it's that optimal dose based on someone's needs and biology and the desired effect.
Yep. Yeah, dose is really important.
Well, I want to go ahead and shift gears just a little bit here. And I want to talk about how, depending on the strain used in cannabis, it's known to have a lazy or in the couch kind of effect on some individuals. And so, can you both explain how cannabis and the endocannabinoid system benefit men before, during, and after exercise or physical activity?
That's an interesting question. It depends on the amount of alertness that you need for the sport. If you're, in a professional sport, then usually it's a banned substance in most cases. So usually I think about it as something that professional athletes might use afterwards, even though it still may be banned, because of drug testing. But hopefully that will change. I think in the Olympics and skiing, it wasn't a banned substance at a certain point. And the winner of the downhill Olympics about 20 years ago, was very open about the fact that he used cannabis beforehand. So for some people, it can, decrease enough anxiety so that they can perform better. But again, it's dose related. And for some people, too much of anything can be a problem. So nowadays, that cannabis, because of cannabis being legalized, almost all states are having cannabis tested for the amount of THC, the amount of CBD, so people can actually start seeing what works for them. Because before that, you only had something with a name on it and a smell, and you had other people telling you what to expect. But now we actually have objective findings of how much THC, how much CBD, so people can decide for themselves. Now, as far as indicas versus sativas, I don't know how much weight that carries anymore. I think in the past, when we didn't have anything else, the folk wisdom of sativas for daytime use, indicas for evening use carried some weight. And it might have had to do with how much CBD. There might have been a little bit more CBD in the indicas, but I don't know that because I don't think we were measuring for it back then. But that's the general wisdom of sativas for daytime use, and I picture people running around playing frisbee, whereas an indica for evening use, when you're beat up from the day and you muscle soreness and you want to sit down and watch TV, not necessarily just go to sleep, but you need to relax. So that's the general wisdom: sativas for daytime use, indicas for evening use. But now that we can measure CBD versus THC, I think that's more important. And the fact that most cannabis is a hybrid now. It's hard to find a pure sativa and a pure indica. So I think knowing that the THC and the CBD profile is important. And of course, I don't want to forget that there's 200 other cannabinoids out there. But the important ones that we know the most about are the THC and the CBD.
What I might add to that is it's not uncommon for men to have an exercise regimen, let's say at the end of the day, and to, let's say, have a few beers or a few drinks or even wine after their exercise. But like, oh, I exercised really hard, I'm gonna have a few drinks now. Um, Comparing that to having cannabis instead, we know that one, even a few drinks can reduce the ability of muscles to repair and heal, to actually benefit from that exercise. And then if that carries over into nighttime, again, only 2 drinks will significantly disrupt our sleep, which would reduce the ability of our body to repair and benefit from exercise, oxygenation, all of that kind of stuff. So if someone is looking to enjoy a substance after an evening workout, from a harm reduction perspective, hands down, cannabis is going to be much better for making gains from exercise than alcohol, which actually takes away from some of the potential benefit.
Mm-hmm. Well said. Yeah.
Thank you both. Okay, so I want to move the conversation forward just a little bit more. And so here's another question that I'm going to direct to you first, Sarah. And so it's Dr. Norman B. Anderson from the American Psychology Association wrote that men of color overall have lower life expectancies than whites. African American and Latino males are 6 times more likely to be victims of murder. American Indian males have the highest suicide rates, and African American men are more likely to be incarcerated, unemployed, and exposed to more childhood adversity. A study done by the Center for Disease Control and Prevention showed that men who experience anxiety and depression, only 26.4% of Hispanic and Black men sought mental health treatment, compared to 45.4% of white men who sought mental health treatment. And so the question is, what are some ways or steps that community leaders and mental health providers can use to destigmatize seeking mental health treatment?
So I will do my best to say this succinctly, but I'm going to refer to slide 2 in this, where I tried to gather some slides together. And this is such an important question. And I tried to kind of break it down into community leaders, mental health providers, and business owners. I'll just kind of verbally walk through that. Community leaders, one of the things we know from the research that's been done on how we can increase the likelihood of seeking out professional mental health from providers is if people can implement screenings in what they do. And there are a lot of creative ways to, as a community leader, to incorporate screenings for mental health, whether that's for anxiety or depression or post-traumatic stress, at an activity fair or in different events, or just to like almost the way that we implement blood pressure check screenings at a range of different events. That actually leads to more African Americans seeking out mental health treatment if they get a screening first from a community leader. Then also, one of the things that we can do is focus on the concept of health rather than psychological problems or mental disorders. And I'm going to get into this when I get into the provider side of it. Something that providers have really done a disservice to communities of color in this country is by pathologizing mental health concerns. But as community leaders, if we can focus on optimal health, spiritual, emotional, social, financial, physical, mental, that will help destigmatize seeking out mental health treatment. And also like integrating community values and cultural values with mental health. So, instead of saying, okay, here's some guidelines from, the American Medical Association, so just read them, actually like applying what our community values are to some of those concepts. And while this does require, vulnerability and some emotional labor, for community leaders who are able to share personal stories about how either they themselves or someone they know personally accessed mental health support and found resilience through that, that has a lot of impact, because community leaders have relationships of trust, and interpersonal strength with those in their community. So that has a lot of impact. Shifting to providers, and I'm saying this as a provider who has, thinks about this quite deeply a lot. Something that we have to do if we are mental health providers is commit to becoming anti-racist rather than culturally competent. When I went to school not that long ago, there are concepts around being culturally competent, like if you can study Hispanics or Blacks or Asians, right? And you just know a few key things about them, then you're culturally competent. And that is simply inadequate when it comes to being of service to people of color in this country. And so intentionally developing an anti-racist commitment and analysis, and an ongoing transformation of how we view our work as restorative is absolutely essential. Because you hear it again and again. People of color will maybe try to see a therapist, and that therapist is very problematic or commits a number of microaggressions or makes their environment so hostile, claiming that they have good intentions or they're culturally competent, but simply not having that anti-racist analysis. And that gets into also that we have to learn the history of our field, that as providers, even though it was, decades ago, there are terrible things that we did, whether we were social workers or counselors, psychologists or psychiatrists, terrible things we did to people of color in this country. And so we have to get honest about what we have inherited as our history so that we understand what community reluctance would, like why that makes sense, why people would be concerned about seeing us. One specific example of that is for decades, Black men were overdiagnosed with psychotic disorders compared to anybody else in our country. And when you look at, okay, well, who is doing the diagnosis? Why was the diagnosis being rendered? A typically white provider would hear a Black man, for instance, say that they felt fearful, that people were following them and that they were being watched and that someone was going to get them. And then a white psychologist would say, wow, that seems really paranoid. You must be schizophrenic. Actually, that's a reality of the experience of being Black in this country. So we have to learn the history of our field so that we can be accountable to that and name it when we need to. Harm reduction training absolutely is another restorative practice for us. And then I would see a final piece for providers that we have to go to our graduate programs and demand increased admission and financing in the form of grants for people of color who want to become therapists. We do not have enough therapists of color at all in our country. And we know from research that not only does that benefit people of color to have therapists who are people of color, but even white people benefit from that because they're getting an actual contextualized perspective of what is happening at multiple levels, individually and within this country. And that's something that each of us have the power to demand. And the last thing I would say is that there is also opportunity for business owners to become advocates from their positions, whether they are, for example, working in a beauty salon or barber shop, or they have a community organization, or they're an entrepreneur, they've got a small bodega or grocery store, that business owners have very strong trusting relationships with people in the community. And so if we can help business owners become advocates for mental health care and treatment and make them aware of the resources that exist, that puts them in a position to be on the front lines and actually help people get into care as soon as possible. So I know that's a lot of different kinds of ideas, but really it does require that level of intention and development from all three cohorts.
Yeah, that's a really good wrap up of the whole, a lot of the disparities in the socioeconomic system, which obviously affects people of color so much more. And the number of therapists of color is not as great as it should be. So we need to have more training of therapists of color, or more inclusion. I've had therapists who've referred patients to me for cannabis. We're starting to see a shift now, whereas before, 20 years ago, most therapists would look at somebody using cannabis as a matter of substance abuse because they were trained that way. And they might have even been cannabis users themselves, but closeted. But that's pretty much all that they were trained in, and they didn't know that it could be useful. And I finally saw over the, after 5 years into it, it's been, like I said, 22 years now, or 24 years we've had our law almost in California, our medical cannabis law. And I'm seeing more and more therapists who actually are referring their cannabis patients to me for the recommendations. And so I think that's been a big change that I've seen. So instead of just the social stigma against cannabis, we're seeing therapists that are actually realizing that this can be helpful for patients.
Thank you both. And so we're getting close to our time stamp here a little bit. So I do want to go ahead and jump into another question for us to help us wrap up our conversation a little bit. But I do want for us to explore ways that family members and friends can provide a community of support and help individuals or help men specifically have dialogue about mental health. Are there any insights or recommendations that either of you can offer us on that topic?
Yeah, just kind of briefly, and you can see sort of a breakdown of this on slide 4, where there's sort of a list of like language we can use with friends and family members, where one side is pathologizing and the other side is less pathologizing, with particular attention to, again, research indicating that, disproportionate to other racial groups. If you suggest to Black men that they are depressed or anxious or have a mental health disorder, that they will be less likely to seek out treatment. So one of the things, again, that I would encourage family and friends to speak about is health rather than mental health, to view it for really holistically. Instead of saying, oh, you seem depressed, saying it seems like it's a hard time for you. Using person first language instead of saying like, oh, wow, you're an addict, saying, I'm really worried about your drinking. I'm worried about how you're using drugs. Instead of talking about stabilizing or managing, like stabilizing your mental health, referring to healing, right? This is about restoring, ourselves in relation to others and to the world. And even something as small as referring to, worry and overwhelm rather than anxiety. And again, I think that there would not be this amount of reluctance around mental health concepts if the history of mental health providers had not been using mental health as a tool to hurt communities of color for so many decades before us. But as a result, the way that we describe our concerns to people we love has to come from a holistic place rather than a pathologizing place.
Wow, thank you. And Dr. Lucido, when you jump in, can you I guess broaden it a little bit more to just be about health in general? As Sarah was suggesting that we kind of like drop it from like it just being solely about like mental health, but think about it as health more holistically.
You mean cannabis itself?
Well, yeah, in this case.
Yeah, well, thinking about cannabis and health more holistically, first of all, you think about dosing. It shouldn't be necessarily that more is better. People have to figure out their dose, like with anything, whether it's alcohol, whether it's food. So a certain amount can be helpful, and more than that can be less helpful. So I think that's really important. That people, whether it's you learn that from your peers or whether you learn that from society at large, but certainly as a physician, that's one of the things I ask in my questionnaire is how much cannabis are you using? And early on, I found one one patient was saying, as much as I can, whenever I can. And then I finally realized, at first I thought, is this a plant? Is this a narc? Because early on in those days, doctors had to be concerned about, were the narcotics officers trying to catch doctors? But I realized he was sincere. And I said, you probably need to use less cannabis and a better quality so that so it's a matter of, it had to, every individual has to be looked at as one person and try to figure out what they're doing, what they need to be doing, and whether they need to do it differently.
So I just want to thank you both, Sarah and Frank, for all of your insights that you've provided us today. And so I do want to give you all an opportunity to share with our listeners what services you all are providing during this pandemic and how you all can be best reached if anyone wants to engage with you all further from today.
So our office is located in Chicago, but we have been fully virtual in our services and operating like that since March 23rd. And we are here to help people with a variety of things that come up, in the stress related to the pandemic. So if you want to follow our social media, we are at Chicago Compass. And if you want to reach out to schedule a phone screening or consultation, you can reach out to our intake coordinator, Robin, at intake@chicagocompasscounseling.com.
Great. And you can reach me, Dr. Frank Lucido, at info@drlucido.com. So info@drlucido.com, but without a dot. Without the, it's info@drlucido.com. And my phone number, 510-848-0958. We'll generally get an answering machine and we can return your call within a day.
Thank you both. Well, that wraps up our segment on men's health today. And thank you again for all of your insights in this conversation.
Thanks for having us.
Yeah, thank you.